So, while looking at the introduction to anything radiology, that's imaging, so we're trying to look at some scenarios where some one or two mistakes could actually occur in the lab. So one of these mistakes is a patient who is supposed to be imaged could actually leave their keys in the pocket. So let's talk about the dangers of this and also look at images which could actually show this error. So you see that they wanted to image this, and the patient was having their zip on, was also having keys in their pocket. So when keys are left in the pocket, it's usually dictated when you are doing a hip, imaging. So it leads to an image artifact. So metal objects like keys, they block or scatter X-rays. This will now create bright white areas on the image. So it will lead to poor image quality, right? So diagnostic errors too. So the keys could actually block the underlying joint, the underlying soft tissue. So even if there's a pathology there, the person reading it will not be able to pick it quickly. Then it will lead to repeated imaging. Of course, the imaging will not be nice, so they will always want to do it again. All right. Then workflow delay. So retakes slow down the imaging process and can delay the diagnosis and also delay the treatment. So you see this person too left keys in their pocket. So best practices in radiology is before the imaging, you have to check out the patient and make sure that they don't have anything like keys, they don't have anything like coins, they don't have anything like jewelries, they don't have anything like belts on, they don't have anything like the zip on. Just like we saw in this image, you could see the zip there. Okay, use of gowns. So they usually give you an imaging gown, which is mostly disposable after the imaging, so you have to put it on. To clear communication, so the patient must actually be informed and given reasons to why they don't. Do you understand? You don't just command them around, but you actually give them reasons to why. So if it is noticed, always document a case where you actually notice this, just like these cases were documented and we're here still talking about them.